Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources. Welcome to today's edition of Helping Seniors Television from the Helping Seniors Network. Whether you are caring for a senior, are a senior, or just plan to be one, we hope you'll enjoy today's program. On today's edition of Helping Seniors TV, Dr. Lee Sheldon, a noted periodontist, and his guest, Alfred Nuttall, joins Joe Steckler for a good discussion with good examples of the importance of getting a second opinion. Now, here's Joe.
This is Joe Steckler, folks. I'm your host for this edition of Helping Seniors. My panelists this morning are Dr. Lee Sheldon and Al Nuttall, and we're going to talk about Al is not a doctor. He is just like you and me mostly. We're retired from our careers, but we have stories to tell, stories to share. And Dr. Sheldon and I have done many shows on radio and on television over the years about medications, the use of drugs, the use of good solid diet, the use of salt, you name it. We've talked about it.
Duct tape for warts? I mean, there's all sorts of things we can talk about, Joe.
There are, but we've never talked about this.
No.
The value of a second medical opinion. And Al is a friend and client of Dr. Sheldon's. And when we talked about a show, Dr. Sheldon said, how about I bring somebody that can share some stories with us that just purely a story, not from a medical viewpoint, not from anything like it, just like an average viewer watching a television show. But first, Dr. Sheldon, I ask you, you've had some medical experiences. But you start the show for us today so our viewing audience can get an idea of what we're going to talk about.
Well, I think it's important, Joe, that we understand that I'm going to be speaking from personal experiences as well, not just as a doctor type, but also what I've gone through as a patient or as the husband of a patient and things that I've experienced. In fact, we've got so many experiences that would take much longer than this show allows.
Well, I know that, but it depends on what experiences you're going to talk about now. But let's talk about medical experience.
All right, let's talk about medical experience, and we're going to start because I wrote a column also this month, a magazine column, so it follows with that. And my wife has given permission for me to talk about her. So my wife had a colonoscopy done, and in the colonoscopy there was a type of problem. You know how you go in the colonoscopy and there are polyps that are sticking out of the gut, and the gastroenterologist will trim away that polyp and send it out for biopsy and that type of thing. Well, her polyp wasn't sticking out; it was flat, and so the gastroenterologist couldn't treat it. And so when we got all done, she said, "You're going to need surgery for that." And appointed us with, I said, who's the surgeon you'd use? And the doctor told us the surgeon, gave us some choices, and so we went and made an appointment with the surgeon. Found out what the surgery would involve, which would be abdominal surgery, even laparoscopic through a scope, but it would be abdominal surgery. She would be in the hospital for 3 to 7 days, and it would be 4 to 6 weeks for recovery. So we heard that and went back to the gastroenterologist and said, what's up? And the gastroenterologist insisted that the surgery needs to be done. The surgery needs to be done. That is a precancerous type of lesion, or it could be cancer. Even though she biopsied it and found out there was no cancer, still you can't biopsy everything. And we took that certainly at face value. We said no, and my wife said no. It wasn't me. My wife said no a few times. She said, well, I can see you're not going to get the surgery. Well, let me tell you. There is somebody at the Mayo Clinic who does it without doing surgery. That doctor can go in through the colonoscopy and has a particular technique that he uses and can trim it off without doing abdominal surgery.
Who told you this about this?
The gastroenterologist the gastroenterologist here said that there finally is another way that it could be done. But it was after a certain amount of begging and cajoling before we finally found out that there was somebody else who could do it without going through the gut. So we went up to Mayo Clinic, and sure enough, we saw the doctor, gastroenterologist. He said, I've done 2,000 of these. I learned it in Japan. I've been doing it for 10 years. I have a 98% success rate. And Eleanor had the procedure done, and it came out fine. There was a recovery period of, as you would expect, of maybe a couple of days, but not the recovery period that would be involved with open surgery. So the question that she had is, why do you have to keep on disagreeing and disagreeing and disagreeing before you finally find out there's a far less invasive procedure that can be done? And so that's where we're talking about the value of a second opinion, but it's also the value of taking responsibility for your own care and looking at perhaps online or talking with someone else if you don't have the guts to keep on disagreeing and disagreeing and disagreeing.
But to be fair about it,
yeah,
to be fair, Eleanor knows what your capabilities are. She's been around the medical field for a long time, yep. And she knows that the chances are there might be an alternative way to do something if you just find a person who can do it.
Correct. She does.
That person watching the show that I'm pointing to on that camera, most of them don't know that.
That's correct. But Eleanor may know a little bit because I do what I do and I talk the way I do and because I'm involved in healthcare. But still, this came from Eleanor saying, no, there's got to be a better way. And she didn't even get a second opinion. She kept on asking this particular doctor until this particular doctor finally said, well, we know about this at Mayo Clinic. So it just don't accept the first opinion at face value. The first opinion may be the proper one, may be the only one that's available, but keep on asking questions until you can get other answers.
But how does a person that's just asking for a diagnosis or medication or help from pain, how do they know when to keep asking questions? See, that's the hard call.
And I'll tell you, in a case like this, it may be that you would see another doctor of a similar type. This happened to be a gastroenterologist. See another gastroenterologist. Or take a look online and look at a particular website that we use called PubMed, P-U-B-M-E-D. Go to pubmed.com, type in the particular problem, and see what shows up in the medical literature. You may not be able to read the medical literature. It may be in too much doctor language, but you may be able to see that, in fact, there's somebody else who's been doing some research, and you'll see a certain name that's been doing a lot of research in this particular area. Do what I did. Call that particular doctor and say, do you treat this particular type of problem? And you can find out who the experts are, because you continue to see the same name associated with that particular type of problem.
But having said all this, there's nobody that knows your own body like you do.
You're right.
And the reason I say that is because I have been diagnosed many years ago with fibromyalgia. It kills me at times. They put me on a drug. They took me off this drug. For 3 months, I didn't know if I was going to live or die. I was in constant pain, water retention, cold sweats, hallucinations, you name it. I had about anything that could happen to a person. And it also caused me to go back and think about when I first had my conditions with my heart and everything. The chances are that what was happening to me wasn't going to kill me, but I needed to do something to do something better about taking care of myself. Does that make sense?
It does. And so even in that particular circumstance, before you go on a medication, it's not bad to look up what the effects are of that medication, and particularly in light of that particular problem. It's much easier to get on a medication than it is to get off a medication.
And see, well, that's the other part. I wrote an article about doctors know a lot about putting us on something, but we know less about taking us off. We don't know the side effects of these drugs.
That's right.
We spend a lot of money developing that darn thing, see what it can do, but we don't spend much time seeing what it's not going to do to us if we don't take care of it.
That's right.
I think a classic one of those is the blood pressure medication lisinopril. And in that one, it turns out 20% of the people that, or some number in that range, about 10 to 20% of the people that take it develop this cough. But you're dependent on the primary care physician to tell you that if you start coughing after we've prescribed this, having this cough, you're not sick, it's because of lisinopril, and then you have to change things. So it's kind of like a cause and effect thing. Sometimes you don't even know the right questions to ask, and you just got to know your own body to say, this isn't normal, this isn't right. So you don't sit there and accept it. You have to say, ask about it, pursue it, and try and find out if there is a medical
It's interesting you should say that, Al, because I take lisinopril in the morning and at night for my blood pressure.
Right.
I've been taking it for years. I've never had the symptoms you described.
Right. My wife is on it as well, and she's never had any difficulty with it. But another time I was at my regular dentist, and the dental technician was in there. She was kind of doing that kind of little cough, and I said, "Are you okay?" And she says, "Yeah, I just had some blood pressure. You know, it turns out I have high blood pressure, and I'm now taking this medication." And I said, "Well, you better go back to your primary care person and get on a different one, because that cough is from the lisinopril," because she had acknowledged that that's what she was taking. So you just really have to pursue that. If, like you said before, that affects your body, and you have to know if there's a change. And you really got to find out, is that change because of the medication that I'm taking or some other reason?
A lot of times we can learn a lot by just listening. And we don't have to accept what we hear, but it might trigger our own care mechanism that says, you need to take another look, or you need to ask a question. And I think too many times we're afraid to ask the question because we're afraid of what the ultimate diagnosis would be. I think we're so attuned to the fact that if we have a problem in our body, we can't understand it, we think it's cancer. You're a doctor. Am I correct or not?
Yeah, I think that's the ultimate fear that there. Yeah, and don't be alarmed when sometimes we, and I'll include myself in that category, since I'm in the healthcare profession. Sometimes we play upon fears in order to be able to get a patient to accept treatment. I try not to, but believe me, fear, and particularly fear of dying, is a very powerful motivational sales tool to get somebody to do something.
Oh, I agree, 100%.
Yeah.
But you had a personal story too, Al.
Well, mine is about cancer, absolutely.
Oh, okay.
And it turned out 17 years ago, I was diagnosed with an ameloblastoma, which affected the jaw. So basically, how do you fix that? Well, I was sent to a specialist in town. They said, okay, well, we've got to cut out the tumor, take the adjacent teeth, and then cut out a chunk of bone. And then I said, okay, and then in 5 years, we'll put something back in there. And well, wait a minute, I'm not working. What are you going to, I got to go 5 years without, part of my front jaw? I said, well, that's kind of how it is. We got to wait to make sure the cancer doesn't come back. So I said, well, this wasn't going to work for me. And I'm embedded in my career and, out seeing people, and I was just wondering whatever this thing was going to be in my mouth. So I went to Orlando and contacted a physician and a dental surgeon, and he says, well, yeah, we do have a solution for that. We're going to do exactly that. We're going to, remove the tumor, take out the teeth and the bone until the margins are clear. But then, immediately, we're going to take a piece of bone out of your hip and put it back in there splice it in there, and then you're gonna have implants after that, and within 10 months, I was functional again. And of course, the question that everybody would ask is that, what if the cancer comes back? Well, then we have to do it again. It wasn't going to be that I'm being taken out of here. It's the procedure would have been repeated. And I was much happier having regular teeth within 10 months than waiting 5 years to have the solution.
Did you know Dr. Sheldon at that time?
No, actually afterwards, as far as the follow-up for the implants, he developed a plan to make sure that the implants, kept stable.
So you did the implants?
No, I didn't do the implants. We're doing the maintenance care only.
The maintenance.
Yeah. So all of the surgery was done in Orlando, right?
Right. Yeah. The surgery was done in Orlando, and then the implants were done associated with that. There were some issues with the gum and the implants, and then Dr. Sheldon came up with the plan to make the implants accessible so that they could be kept clean and healthy.
It's interesting that we're discussing this today because I think you know the story. I've told this to you before. But one of my tours in the Navy, I was executive officer on a submarine tender, and we had three dentists on there, and one of them was a guy named Jim Fierstad. Jim Fierstad was one of the top dental surgeons in the United States, and people came to him with their faces shot apart from Vietnam. Mm-hmm. Jim repaired them, put bone in, did all this kind of stuff. And to know that guy had hands that could do that, you'd never know it from his attitude and the way he was the most easygoing guy. He just accepted everything. But when he took a patient, he really took a patient. Yeah. And that, we're too afraid, I think, sometimes to share that story. In the 17 years, have you had any problems from that, Al?
Oh, no, none whatsoever. And every time that I do go to the regular dentist or to Dr. Sheldon, we kind of rotate back and forth on the cleanings. There's been no evidence of the return of the cancer. So I've been, thrilled with that decision. Now, the end result is the same, but instead of waiting 5 years to get that resolved, it was a 10-month thing. I think that part of all this, being your own best advocate is timing too, because maybe the procedures are going to be similar, but the timing can affect your life a lot. I've had one just in the past few months where the typical prostate issues of the person our age, and the local medical community and the insurance, we were going down a certain very, very conservative path, and we kept getting these roadblocks over tests, procedures, how do you do this, how do you do that, to make sure that it was acceptable to the insurance carrier. Meanwhile, I'm having all these episodes. I've been fighting it for a couple of years now, and then finally made a personal decision to go to the Mayo Clinic and get the thing resolved once and for all without the insurance company standing in the way of of the fix. And so,
let me ask a question. How old are you now?
I'm 71.
Okay, so when you went there, you were covered by Medicare, right?
Yes. Well, many of the local plans are Medicare Advantage ones, and they're pretty restrictive as far as getting people out of the network.
Okay, without naming anything, so do you have an HMO plan?
I did before, and again, to be able to get out of network, I needed to switch during that open season period in October to December, so that I could choose a plan that would allow me to go to some place where it's a teaching hospital.
So what did you select and what did you do? This is a real life story, folks.
Right. I said, I'm frustrated with the current system I have. I'm going to go to I happened to go to the AARP United Healthcare plan, which allowed me to go to the Mayo Clinic, or pretty much anywhere. If I wanted to go to Hopkins, I could have gone to Johns Hopkins. So those plans are a bit more expensive than the classic HMO Medicare Advantage one, but you don't have the restrictions. And in my case, it was worth it to me to try and get this issue resolved.
Lee?
Yeah, and we've talked about Medicare Advantage plans before. You and I have talked about it on the air.
I know.
You see the commercials. The commercials look great. Oh, and you're going to get your free exercise program and all this kind of stuff. And the fact is that when it's restrictive, it's really restrictive. And you assume the doctors are doctors, and we all know what we're talking about, and we all do the same thing. But you know what? You don't assume that with plumbers. You don't assume that with roofers. You don't assume that with anybody else. You just assume it with us. Well, the facts, Al brings out a very, very important fact. If you're restricted to this, then you can still do the research to find out that there's this. And yes, there's a way of getting out of this, if you want to, in order to be able to take advantage of who would be the best doctor to treat this particular problem.
Right, and every year I get Lance Jarvis, who is the SHINE coordinator for Brevard County, and get him on a TV show, get him on a radio show, and we do articles in the newspaper and all my columns that talk about the open period and say, folks, if you got any kind of a question, you need to go to a SHINE counselor, ask a question. And I sat at home last night with my wife discussing the Affordable Care Act and what Republicans are going to do, and just how we're going to resolve these problems. I would never believe that just opening up the state lines where you can go any place in the world you want to get an insurance program is going to solve the problem. You still got 25 or 30 million people that can't afford insurance of any kind. And the kind of insurance they're going to get from any kind of a plan is something that's like this, when you need something that's going to cover this. And that's what you experienced.
Right, and I've been blessed that I can afford to, because this plan is significantly more expensive than the Medicare Advantage, and I didn't get the gym membership with it to boot, so I had to pay for my gym membership. But again, if you can afford to do it, gosh, a dear friend of mine in Gainesville was on a similar boat, and fortunately he had a situation with urology. They're going to take his bladder, they're going to take his ureter and his kidney, and he only had one of them. And that was the first solution. And he ends up with, after question after question after question, all they do is splice a piece of his small intestine into the bad spot of the ureter, which is incredibly less invasive than taking every part of his plumbing out of there. And so again, there was another person that said, no, this isn't acceptable to me. What else is out there? You just got to keep asking, keep asking.
Dr. Sheldon asked me if it'd be all right if he could bring Al to the show today. If you get any more guys like this, you can always bring them to the show, because I still have the whole show that we can do sometime again on the value of a second opinion. Because what you have shared with us, Al, is personal. And I wish that the Congress could actually hear testimonials from people like you that have had to use the system, work the system, challenge the system, and make the system work on your behalf. And that's...
Well, and it's an important point here, Joe. And the important point is, we think as, let's assume I'm not a doctor type. We think as consumers the doctors are here and we don't know anything. Well, particularly now, with all of the information that's available, you as a consumer can find out what's going on, and you can start to challenge whatever opinion is, or just go out and get another opinion. Just find out before you accept the first opinion, which you may not need to do, or you may not agree with.
But the value of having Al on telling his story as a non-medical person, the people on the other side of this camera can relate to what you went through with, Al.
I hope so. I hope so.
Yeah, and that's the value. That's the value of doing a show like this. Yep. It's not me guiding the show. It's the truth coming out and saying, we shouldn't stop. We should continue to work the problem. Same with me, being afraid for many years to have cataracts removed from my eyes because of what could happen. When I found out with the new technology, we actually filmed the removal of the cataract from my second eye, and within another week or so, well, next month we're going to do the filming with Dr. Darlington from the Eye Institute, who did the surgery. But he's going to talk about it as he did it. And I was the guy that was under that piece of cloth where they had the thing open up, they were sticking that thing in my eye. But being a guinea pig, in certain ways, it's been a pleasure for me to be able to do that, because if people see people they know going through these experiences, you can help solve some of those things. So I'll let you have the last comment today.
Well, I think your last comment is the important one. That you can explore, that you can find people, that you in fact can be an informed consumer, and you can ask some questions yourself rather than just depend upon what we tell you. And the more informed you are, the better the answer I can give as a doctor.
Yeah, the answer isn't always put forth by a medical opinion. Sometimes you find an answer by research, you find it by experiment, you find it by continually asking questions.
Right.
So, I want to thank you, viewer, for watching the show today, because Dr. Sheldon and Al Nuttall have told personal, real-life stories. And if you have a question, you can call our office at 473-7770. And this show will be on television, and we'll tell you when it's going to be on if you give us a call. Thank you for watching. Thank you, Lee. Thank you, Al.
Okay.
Thanks
Very much.
Pleasure.
Good show.
It was a good show.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.